Hi, everyone. Welcome back. Today, we're joined by Dr. Lindsay Leither, the Respiratory ICU Medical Director here at Intermountain Healthcare, to talk about COVID-19 and her experience working in our ICUs. Obviously, you all saw our video that we posted recently about the ICUs and what our hospital system has been dealing with over the last couple of months. And we're here with Lindsay today to talk a little bit further about that. Lindsay, thank you so much for joining us. We really appreciate it. So I want to talk to you a little bit about your role first. Describe to me what your role has been during this pandemic and kind of how it's changed since March when COVID-19 kind of came to the Utah state.
Yeah, thank you. So as I'm a pulmonary critical care physician and work in a couple different ICUs at Intermountain Medical Center, but I'm the respiratory ICU medical director, and variety of things have changed, both as a physician working on the floor, taking care of patients. We're obviously seeing a lot more COVID patients, and we've been taking care of COVID patients since the beginning in March. And there were a lot of system things that changed in terms of our structure of our ICU. We created a lot of rooms that had special airflow to keep COVID patients sort of isolated from the other patients. And that gave us a space to also put on extra personal protective gear before we entered those rooms. And so there's now big carts in the hallways with a lot of the PAPR hoods and gowns and different things to put on before we go into the patient's room. So the unit itself looks a little bit different and feels a little bit more cluttered in a sense because there's a lot more equipment sitting in the hallways. As an ICU, we always have functioned as a team where we have physicians, nurse practitioners, sometimes residents or an intern physicians, fellow physicians. There's pharmacists, there's respiratory therapists, occupational therapists, our critical care techs, and then of course all of our nurses that are on the floor at all times helping take care of all the patients. And so there's quite a few people around. Because we have a lot of patients with COVID, a lot of them tend to be really sick when they're in the ICU. And so there's a sense of extra stress in a way that I've had multiple people mention. They can just feel the difference in the air compared to prior to COVID. You walk onto the unit, you can just tell there's an extra sense of kind of anxiety as people are rushing around trying to take care of a lot of really sick patients. And so I'd say those are kind of the biggest things, just that sense of extra stress, all the extra personal protective equipment on the units, and then the large number of patients who are very ill from COVID.
So our people don't really get to see inside of our ICUs. We don't let people in to see them. Can you describe what your day-to-day typically is when you're working with a COVID-19 positive patient? What happens when you first enter the hospital to when you leave the hospital that day?
Yeah, so one thing that most everyone is doing, it's a little different than before, is that we all wear different clothes to work and we change into our work clothes at work. So that happens kind of first thing. And then often I get my list of patients I'm going to be seeing on my unit, and usually the unit is full or near full of a lot of patients. We meet together as a team with all those people I just mentioned and go through each patient, make a plan each day, go over all their medications and their therapies and make sure they're on the best therapies. We have instituted throughout Intermountain Healthcare kind of a COVID therapeutics round. So every patient that has COVID, we discuss with our infectious disease specialist, other critical care specialist, pharmacist, and then there's a research person part of that we discuss every weekday their care plan and how things are going and make sure everyone's on the best therapies to treat COVID. It's been a very evolving process over the months that we've had COVID. We've learned a lot of things, and so that's been the easiest way for us to disseminate the highest quality, best data and quickly adjust our therapies as more information becomes available with the research across the world. So we do those rounds also in addition to our normal bedside rounds during the day. I can say that when I start my day and throughout my day, I really never know what's going to happen. We have a lot of patients who can seem very sick but stable, on lots of medications and on multiple machines, but seemingly fairly stable. And then the next minute or the next hour can be very unstable, and we're having to rush into the room to try to stabilize their breathing on the ventilator or their blood pressure, or a variety of different problems that can arise. And so some days can feel very chaotic. We kind of feel like you're rushing from room to room, trying to deal with these unexpected problems that come up in people who are critically ill. Also, addition to all that sort of things, there's a piece of talking to families. Normally, we have a very open ICU where families are allowed and able to be visiting almost all the time. We have very few restrictions in terms of patients, or in terms of visitors that come to our ICUs before COVID. Now, of course, with COVID, we have very strict visitor policies trying to prevent the spread of disease. And so families aren't around, which is very different for us. And so we're trying to find other ways to connect with families to make sure that they stay updated and involved in patient care and therapies. And so a lot of my day is spent actually on the phone talking to families to give them updates in the care plan and connect with them, make sure that they stay informed and updated on things that are happening. Our nurses are often also reaching out to families. We have been given a lot of iPads, and we can kind of FaceTime, or I think it's called Google Duo, and use the Samsung platforms to also video chat with families and patients to try to help bridge that gap as much as we can. And so the nurses try to spend part of their day doing that as well. So that's kind of a typical day, I'd say.
When you first heard that about COVID-19, when it first started circulating in the US, you work in an ICU, what was the first thing that kind of went through your mind when you were starting to prepare for potentially having to deal with this virus?
That's a good question. I think that, lots of things ran through everyone's mind as we saw it happening in other places in the world. And I think as a critical care physician, we were very concerned. I was very concerned. I didn't know how it was going to look in our country. It was still evolving, and we weren't sure how dramatic it was going to be. We've seen some kind of similar things happen. Back in 2009, we had the influenza H1N1 epidemic, and we had a large surge here in Utah. And so our health system had a little bit of experience with infectious disease illness that kind of came through. But as we were watching it happen around the world, this seemed like it was going to be a lot more dramatic. And so there was a lot of immediate planning that started happening to put together strategic plans in terms of how to utilize our beds in our hospital, beds in our ICU, as effectively and efficiently as possible. Also, there was a lot of attention paid to trying to resource personal protective equipment. I'm sure lots of people saw the headlines around the world and around the country. There was a lot of concern about getting enough N95 masks or those PAPR hoods and the equipment necessary for those. Even things like making sure we had enough of the isolation gowns that we put on. There's a lot of efforts made and planning made to try to make sure we resourced enough of those supplies, but also didn't selfishly stockpile them and keep them from other areas of the country or other areas of the world that maybe needed them more than we did at the very beginning of the pandemic. And so there's a lot of planning that happened at a very small local level, and then also within the whole system throughout the state, and then within the leadership and political leadership, even with the state, and collaboration with other health systems within our Intermountain West. And so there was lots of concern, fear, unknown, which I think we all were experiencing both in our professional lives, but also in personal lives, and a lot of planning. And that's how we kind of tried to get ahead of this.
You brought up the personal aspect of this. I think a lot of people don't realize that you guys take care of patients all day and then you go home to your family. And maybe you don't have to answer this person for yourself personally, but you deal with a team of people. What's the emotional toll like on your team or people you see in the hospitals that are having to deal with these patients every day? And why is it so important for the community to understand what our healthcare workers are going through?
Yeah, it's a good question. There's a lot of talk about this in the hospital in general, because it's really hard. In everyone's personal life, things are very different. We've all felt the burden of this pandemic. We've had to modify a lot of our social interactions and our interactions with our extended family and our friends and our community. And that in itself is very challenging. And we're all trying to figure out the best way to navigate those things. But then in addition, coming to work and really seeing every day in a very real, personal level, people who are dying from a disease that is otherwise preventable, and who would not have normally died this year. And it's really can be really tough as the increased cases have continued and been higher in the recent weeks. Our hospitals become more full in the recent weeks, and in order to take care of all those patients, a lot of the nurses and respiratory therapists and all the other people, the physicians, are working extra shifts to kind of fill in the need that's there. But it gets very exhausting when you're working extra and having to also face the surging pandemic on a personal life. And sometimes I think for a lot of the healthcare workers, it feels like there's never kind of a break away from it. And we've, amongst ourselves, spent a lot of time talking about those ways to do, self-care, take time for ourselves, find those breaks and things. But it's not uncommon that I talk to a care provider at the hospital who mentions they cried on the way to work today, or they cried on the way home from work today, because it is stressful, and you put on a face when you're at work and try to keep it together, and you have those small moments on your own that can be hard.
It sounds very hard. Hearing you talking about it, I think is really important for people too, because there's this perception that our healthcare workers are kind of in this bubble and they're not really seeing what we're describing, which brings me to a question I want to address. The video that we released didn't feature any patients in it, and I want to talk about why we don't show patients. Why don't we show patients? Why aren't we showing their faces or telling their stories? Why is that not something that's being seen in the media and social and everything like that?
Yeah, that's a good question. There's an important aspect of trying to keep patients' information private. This is a very challenging time in that individual's life and their family's life, and it can come with a lot of emotion and a lot of ups and downs, and it's just really important that patients are able to maintain the privacy. And so we have to be very sensitive to protecting patient information and protecting faces and anything that might identify them to the broader community. And so a lot of it's centered around patient privacy. I think we can all imagine if we were in that situation, it's not one of the highlights in our life. We're fighting an illness and critically ill in an ICU. And so we want to be very sensitive to that and do what seems best for the patients and their families.
We got a comment on the video. I think this person was joking, but around like, yes, I'm in the ICU and I'd love to share my story. It's like you just mentioned, these people are not healthy. They're in the ICU for a reason, and our focus as healthcare workers is to make sure they get better. So the aspect of showing them or telling their story when they're this sick is a little hard. And I know we've told stories about patients who've gone home and gotten better, but it is hard to show those patients that are super sick. I know if I was in that situation, I would not want to be filmed or asked questions or anything like that. I'd want to be able to deal with whatever I'm dealing with by myself. So I think that's really important for the community to know. And another question I have around patients too is, what is the age range of people that you're typically treating for COVID-19 in the ICU? Is there one?
Yeah, so it's a good question. And when we've observed sort of here in Utah that, and around the world, it's similar, that people who are older tend to be more at risk, more likely to end up in the ICU. People who have a chronic medical condition or comorbidity seem to be more at risk. But that's certainly not the case all the time, and we've seen plenty of people of all ages. We've had people in their 20s. Some of the sickest people I've had have been in their 20s and 30s. We've had pregnant women. We've had people kind of in the middle of life. We've had 40 and 50-year-olds dying of COVID in our ICUs. And we've had people that are older or more elderly as well, but it very much is a disease that's impacting and affecting all ages. And certainly there's lots of people that we're seeing in our ICUs as well that don't have a chronic medical condition or comorbidity. that puts them particularly at high risk. And so it really is impacting everyone. The other thing that we've really noticed is it's impacting, all socioeconomic groups. It's not as if there's some group that's protected or something from it. We really are seeing all different types of people in different situations. So I think that we know people that are older that have chronic medical problems seem to be more at risk, but we are seeing people that are younger as well.
And along that same lines, what can I do to protect myself? What are some ways that our community can do their part to make sure that the load on healthcare workers is as easy and less stressful for you guys as possible? What can I do?
Yeah, the biggest thing in the way this is prevented, and we can prevent this collectively as a community, is wearing masks that cover our nose and mouth and socially distance. And part of socially distancing is not gathering in large groups. I know the holiday season's coming, and I too feel tempted to want to get together in large groups, but it is just so important to socially distance, wear that mask, and good hand hygiene is important as well.
And making sure you're wearing your mask correctly. I know that there's a lot of people that wear them under their nose, or they're constantly fiddling with them. And I know it's really important to, once you put it on, try not to touch it. I know it's hard, but wear it over your nose, make sure it fits properly, because otherwise it's not doing its purpose. And you wear a mask every day when you go to work, correct?
Yeah, we are all wearing masks all the time, 100% of the time. And yeah, sometimes you have an ill-fitting mask. It seems like it keeps falling off your nose, so you just try to adjust it and get it secured on there. But I often find that once it's on for a little while, I kind of forget that it's there, and it gets easier. It's a little bit like glasses, kind of. Once you put glasses on, at first you can feel them there, and then you get used to them. I feel like the masks are often the same, but yeah, everyone at the hospital at all times, no matter what their role is in the hospital, they're wearing a mask.
You said you forget. My husband actually does forget that he's wearing them, and like wears them into the house and then doesn't take them off. I'm like, you can take that off now. So yes, I feel like once you get into this routine of wearing it, and it's been 7-8 months of us being in this pandemic, you'll get more used to it. And as we go into the winter season, I know it's super important so that we don't have even more patients in your ICUs, and with the flu and everything, that we really make sure we're wearing a mask, social distancing, and doing what we can to keep you guys safe. Lindsay, what is one message that you'd like to convey to the public and tell them how you feel?
I think so. I think the biggest message is we are at a really critical point in healthcare. We've been hearing in the news that hospitals are getting full. We are not at capacity, but the hospital is getting full, and health care resources, particularly the staff, are getting stretched. And it's very challenging to continue to work at this level and this capacity. And as we see surges in COVID patients, it has a lot of effect on the rest of the healthcare system. So patients who are coming in with non-COVID related illnesses are entering in a health system that's already sort of stretched or near stretched. And that has implications and impact for everyone, no matter what their disease is coming to healthcare. And the more we can do things as a community to prevent this disease, the better it is for everyone. And so again, those things really are wearing a mask and socially distant. It's a distancing. So I think that would be my main thing, to really be diligent about that. And it's been easy to get kind of complacent about that since we're now, 6 or 7 months into this pandemic, but to really recommit to doing that.
Well, Lindsay, thank you so much for joining us. I really appreciated you sharing your firsthand experience and kind of sharing your knowledge with us and a look inside this ICU. And if you haven't watched the ICU video, I'll post it after this live so you guys can go ahead and watch that. It features Lindsay and a couple of other nurses and doctors throughout our system just talking about their experience. If you have any questions about COVID-19 or experiencing symptoms, you can go to intermountainhealthcare.org, and there is a chat bot in the lower right-hand corner that can help walk you through what your symptoms might be to see if you qualify for testing. If you do, it'll give you a list of testing locations that are available throughout the state. We also have our emotional health relief hotline still available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. It's a great resource for anyone in our community to get some help and support they need during this time. Lindsay, again, thank you so much for joining us, and we'll talk to you later.